Welcome back to Nurse Brain RX. In this video, we're going to review common PRN medications used in geriatric patients. PRN medications are given as needed to treat symptoms such as pain, nausea, constipation, or allergic reactions. Understanding these medications is essential for safe nursing practice and clinical decision-making. Let's start with pain management, which is one of the most common PRN medication categories. Common options include acetaminophen, Tylenol, often the first-line medication for mild pain in older adults. It has fewer gastrointestinal side effects than NSAIDs. Ibuprofen and naproxen are non-steroidal anti-inflammatory drugs. They help with inflammation but must be used cautiously in older adults due to risks of kidney injury, GI bleeding, and cardiovascular complications. Topical rubs, such as a 5-35 or Voltaren gel, are frequently used for localized musculoskeletal pain. Nitroglycerin spray may be given PRN for chest pain related to angina. Next are medications used for nausea and vomiting. Common PRN options include dimenhydrinate, Gravol. It is commonly used for nausea and motion sickness. Ondansetron Zofran is frequently used in hospital settings. It is effective and generally well tolerated. Metoclopramide Maxirin helps with nausea and stimulates gastric motility, making it useful when delayed gastric emptying is a contributing factor. Constipation is extremely common in geriatric populations. Due to reduced mobility, medications, and decreased fluid intake, PRN treatments include Senokot, a stimulant laxative that promotes bowel movement. Suppositories, such as glycerin or bisocodyl, stimulate rectal evacuation. Enemas are used for more severe constipation or fecal impaction. Polyethylene glycol powders, PEG, are osmotic laxatives. They draw water into the bowel. Milk of magnesia is another osmotic laxative commonly used in acute constipation. For diarrhea, two commonly used medications include loperamide, Imodium, slows intestinal motility, and reduces stool frequency. Diphenoxylate with atropine, Lamotil, is another antidiarrheal used when symptoms are more severe. Always assess for infection, dehydration, and underlying causes before administering antidiarrheal medications. PRN medications may also be used for shortness of breath. Examples include Ventolin, salbutamol, a short-acting bronchodilator that opens the airways. Atrovent, ipratropium, is another bronchodilator commonly used in COPD. Oxygen therapy may also be administered PRN, depending on the patient's oxygen saturation and clinical condition. For heartburn or acid reflux, common PRN medications include Gaviscon, Maalox, and Tums. These medications act as antacids, neutralizing stomach acid and providing quick symptom relief. For patients attempting to quit smoking, nicotine replacement therapy may be ordered PRN. Options include nicotine patches, nicotine lozenges, nicotine gum, and nicotine inhalers. These therapies help reduce withdrawal symptoms and cravings. Finally, medications for itchiness or allergic reactions include diphenhydramine, Benadryl, an antihistamine used to reduce itching and mild allergic reactions. Epinephrine, EpiPen, used in severe allergic reactions or anaphylaxis, which is a medical emergency. These are some of the most common PRN medications used in geriatric care. Always remember that when administering PRN medications, nurses must assess the patient's symptoms, verify the indication, and evaluate the effectiveness of the medication. If you found this helpful, subscribe to Nurse Brain RX for more nursing tips and medication breakdowns.